Mr. Majewski's Anatomy 32 class lecture, Chapter 19, Part 2, Sympathetic and Parasympathetic Divisions. So, let's start by focusing on the sympathetic division. Now, to start with, the sympathetic division is also often known as the thoracolumbar division because when it leaves the spinal cord, it leaves through the thoracic and part of the lumbar portion of the spinal cord. And initially, you have the preganglionic neurons that are leaving the spinal cord. They're coming from the lateral gray horn and going out the anterior root. They will then go into a structure referred to as the sympathetic trunk ganglion. There are two of these, which are a long vertical row of ganglia on either side of the vertebral column. So it's kind of like we have baby spinal cords running alongside the big mama spinal cord. And they receive the preganglionic axons, but only from the thoracic and lumbar segments, so only the sympathetic division. And when the axons enter the sympathetic trunk, they have one of three main options. One option is to synapse in the first ganglion they come to. And then that ganglion postsynaptic ganglion will go to its target. The second option is to either go up or down the sympathetic trunk to synapse in a different ganglion. And the final option is to pass all the way through the trunk, maybe going up, maybe going down, but the whole point being is it doesn't synapse there, and instead goes to another ganglion called a prevertebral ganglion, and there it will synapse. And these are referred to as splenic nerves. So splenic nerves are sympathetic preganglionic axons that leave to synapse somewhere else. So, the way that the preganglionic neurons leave the nervous system is through the rami communicantes to get to the trunk ganglion. So, it also then has the sympathetic post-ganglionic axons can also return back to the main nerves through the gray communicating rami. So the white communicating rami take the preganglionic sympathetic neurons out of the main nerve, and then the gray communicating rami can return them to the spinal nerve to allow for innervation of blood vessels, sweat glands, and the pili muscles found in the body wall. However, the more common possibility is that the post-ganglionic axons are then going to leave the trunk and go to innervate whatever is important. So, for instance, they may go to innervate join nerves and innervate the heart or other blood vessels found in the head, shoulder, and neck region, and this would be up in the cervical trunk ganglia portion of the sympathetic trunk. Or, if they're coming from a lower portion, they may be going instead to various organs found in the abdominal pelvic cavity, where they will join into some of those plexuses we talked about earlier and follow blood vessels to the important organs, whether it's the GI tract, the kidneys, the urinary bladder, and so forth. And it turns out that these are the prevertebral ganglia. So to get to these various organs in the abdominal pelvic area, you're going to have splenic nerves that are then going to have a synapsing occurring in a prevertebral ganglia that will then go on to the small intestine, kidney, or whatever. So, here is again a view of the splenic nerves, which leave the trunk ganglion structure without synapsing and then synapse in a prevertebral ganglion to get to the effector. And This is, well, let's be honest, really complicated. And some of the splanchnic nerves are actually coming from the thoracic cavity and going into the abdominal cavity in order to get to the effectors that they find most important. So there are four main prevertebral ganglia. You have the celiac ganglion near the sacral trunk, the superior mesenteric ganglion, the inferior mesenteric ganglion, and the aortico-renal ganglion. So the preganglionic axons of the thoracic region that can form greater, lesser, or least splanchnic nerves that then will enter the abdominal pelvic cavity. And then, of course, the preganglionic axons of the lumbar region can form a lumbar splanchnic nerve for these same plexuses and vertebral ganglion. All right, now it's worth to point out that when the postganglionic neurons leave either the trunk, sympathetic trunk structure or the prevertebral ganglion, that they are unmyelinated. So there's no myelination, which is why they're kind of grayish, and they lead to their effectors and cause what's called the fight or flight response. So the fight or flight response is a response to a signal from the sympathetic division. Some of these responses include having your mouth dry up, having your heart beat faster, having your stomach stop making you feel hungry, having you basically lose sexual desire because basically something bad is happening and you need to either fight it or run away. So you're not going to think so much about eating and sleeping and things like that. Now we get to the parasympathetic division. It is also known as the cranial sacral division because either it's coming out of the brain itself or it's coming from the sacral area of the spinal cord, cranial sacral. When it comes out of the brain, it is flowing through specific cranial nerves, specifically cranial nerve 3, 7, 9, which terminate in 4 terminal ganglia in the head, or it's going through central cranial nerve 10, which then enters various plexuses to innervate many of the organs found in our trunk. The sacral portion sends out its splanchnic nerves that are then going to enter plexuses that are mainly found in the pelvic region. So the parasympathetic ganglia, where the synapsing between the pre-ganglionic neuron and the postganglionic neuron occurs, are often called terminal ganglia because they are often in or near the wall of the target organ. And that means that the postganglionic neurons are often very short. So, there's only 4 terminal ganglion you need to know the names of found in the head. You have the ciliary ganglion, which innervates the smooth muscle fibers of the eye. You have the pterygopalatine ganglion that innervates the nasal mucosa, palate and pharynx and lacrimal glands. You have the submandibular ganglion, which is going to lead to innervation of the submandibular and sublingual glands, and the otic ganglion, which will innervate the parotid gland. So, the final response that is caused by the parasympathetic division tend to be things that fall under the rest and digest response. Things you would do because you are feeling safe. So you may take a nap, you may get hungry and want to eat. This response is also known as the feed and breed response because it's tied to a lot of the autonomic nervous system's response to sexual stimuli. However, it's worth to note that the sexual stimuli response is actually both connected to the sympathetic and parasympathetic divisions. So some possibilities. Well, the parasympathetic division can lead to responses such as contracting pupils, inhibiting heart rate, constricting the bronchi, stimulating the gallbladder and the stomach, contracting the bladder so you can, hey, now that you're relaxed and feel safe, you can go to the bathroom. The sympathetic division includes things like dilating the pupil for fight or flight, inhibiting salivation, relaxing the bronchi, accelerating the heart, stimulating release of glucose by the liver, stimulating secretion of adrenaline from the adrenal glands, and basically relaxing the bladder and contracting the rectum. However, it's worth to note that these are not all or one or the other. You can have both signals from the parasympathetic and the sympathetic division at the same time, because normally we're kind of in a mixed sort of world. However, the fight or flight response tends to dominate when we are actually truly scared, because the adrenal gland is going to release norepinephrine, which we know is a neurotransmitter for some of the sympathetic neurons. So that means they will be responding throughout the body rather than in isolated cases based on very specific stimulus. All right, so what is the simplest visceral reflex arc? Well, it's a little more complicated than we saw in the somatic nervous system. So you have the receptor, which could also be the sensory neuron. The sensory neuron is then going to go through the dorsal root ganglion and then enter the spinal cord. There you can have potentially an integrating neuron that will process the information, blah, blah, blah. Usually information goes to the brain. But it could skip all that and go straight into the preganglionic motor neuron, which will then synapse at some point with the postganglionic motor neuron, sending the response to the appropriate visceral effector. So it could potentially have 6 players, although that could actually be less than that if the receptor and the sensory neuron are the same, and you skip the integrating center to go straight to the preganglionic motor neuron. All right, possible autonomic nervous disorders. Well, there's Raynaud's phenomenon. This is where people's fingers and toes will lack blood flow, or ischemic, after exposure to cold or also emotional stress. And when I say exposure to cold, I mean like opening the freezer, that brief temporary bit of cold exposure. And what happens is basically there is too much response by the sympathetic nervous system, and this is stimulating smooth muscles in the arterioles to close in order to preserve body temperature, even though it's not necessary. If these arterioles stay closed for a long period of time, it can lead to death of that tissue. So as you can see here, this woman apparently has the tips of her finger have basically died from lack of blood flow. That's it for the Chapter 19. I hope it was as clear to you as it was to me.